Agitation. What does that mean? We see this embedded in a lot of our notes. We even see it as part of the diagnosis justifying, let's say, a psychotropic drug, an antipsychotic on the chart, dementia with agitation, or dementia with behaviors, listed as a justification for a drug. This is a meaningless word that probably needs to be purged from our diagnostic vocabulary. At best, it's descriptive of a wide range of behaviors that we associate with dementia, but that agitation could be rapid pacing, it could be fidgeting, it could be repetitive vocalization, it could be striking out at other people, and it's pretty much useless, as are those other categories of the behavior. And why is that? It's because, as R.C.W. Hall tried to teach us at the turn of the century, no psychiatric symptom is the sine qua non of any psychiatric disorder. What do we mean by that? No, it doesn't even have to be a psychiatric disorder. This person is crying. Is that like a lab test, like a low hemoglobin indicates anemia? No. The person is crying. Are they depressed? Well, they might be. But I've seen people that cry when they're happy at a wedding. I've seen people that cry when they're frustrated. I see people that cry when they're insulted and embarrassed. And they cry when they're in pain. So there's a whole bunch of explanations for crying that don't lead us anywhere in the diagnosis of what's causing the crying. And this is fundamental to the rest of the talk, that we don't treat behaviors with drugs or non-drug interventions. We use the behavior, what is the behavior, as a clue to the etiology of the behavior problem, but it's actually not even a very good clue. It's in the mix, but it doesn't help us very much. So if the resident is striking out at other people, what does that tell us about why are they striking out? Almost nothing. If we get a little more granularity, if they're punching at anybody who's the opposite sex, or punching out anybody that's the same sex, or punching out anybody that gets in their territory, in their personal space, or punching out aid staff when they do pericare, or punching out, looking all over the nursing home for one particular guy and punching him out. Each one of those things maybe gives us a little bit more of a clue as to the cause of the behavior, but again, not very much. We have to go to a lot of other things to get to cause.